Welcome back guys. Now let's discuss about concepts of compliance and elastance. Sir, what exactly do we mean by compliance and what exactly do we mean by elastance? Most of the students will confuse in this topic. Most of the students will think, for example, if anything which is stretched, if I am stretching a rubber band, usually students will think that, sir, it is having elastic property, that's why it is stretching. No, that's not elasticity. If I am stretching an object and if it is easily getting stretched, then this property is called as a compliance. So, compliance is also called as a stretchability or a distending capacity. Then what is elastance? For example, imagine I am taking a rubber band. Now, I am just stretching it. So, this stretching is called as a compliance. The moment I leave this rubber band, it is going to come back to its original position. It is going to go back to its original position. So, recoil in nature, getting back to its original shape or resisting the deformation in its shape is called as elasticity. So, rubber band, if I am stretching it, that is compliance. Leaving the rubber band, it is going back to its original position, it is called as elastance. So, our lungs, they are stretchable. So, lungs are having certain compliance and lungs are also having a capability to collapse back. So, elastance is there. So, that is what we will discuss now. So, the concepts of compliance and elasticity. First, now let us discuss about the compliance. See, compliance, as I have explained to you, it is also called as a stretchability or distending capacity of any substance. Stretchability or distending capacity is measured with compliance. Now, what is the formula for the compliance? Formula for the compliance is delta V by delta P, change in volume with the change in pressure. For example, imagine that there is this one balloon. Okay, imagine that there is this one balloon. I have just gave a little pressure change. I have put some pressure into it. Now, the volume is going to change or not? Volume is going to change. For example, I gave a pressure change of, or I kept a pressure of 5 mmHg. Now, it is going to expand by 5 liters. I kept 5 mmHg pressure change. Now, it is going to expand by 5 liters. Now, just imagine other balloon where I am giving same 5 mmHg pressure. Now, it is expanding 50 liters. So, which is more compliant? The second balloon automatically. Why? Because with the given pressure, who is changing more volume? Balloon B. So, balloon B is more compliant. It is easily stretchable. With a little pressure change, it is getting more stretched. So, compliance means how much volume is getting changed for a given pressure. Okay. So, that is the compliance. Change in volume by change in pressure. Okay. How much volume is getting changed with the change in pressure. That is the formula of compliance. And even our lungs have compliance. What is the normal compliance value of the lungs? The normal compliance of lung is, your lungs will change a volume of 200 ml for 1 centimeter of water pressure. If you give 1 centimeter of water pressure, now lungs will expand 200 ml. Lungs will expand by 200 ml. So, this is the normal compliance value of lung. Okay, this is the compliance of the lungs. Now, so compliance is a word which can be used alternatively with the expansibility or distensibility. Compliance is exactly opposite to surface tension. Why? Why? Because surface tension is a collapsing force. Surface tension is a recoiling force. Surface tension collapses the lungs. But what is compliance? Compliance is stretchability. So, for example, if I say more is the surface tension. For example, there is this one person where surface tension is more inside his lungs. So, automatically his lungs are less compliant. If you want to expand his lungs, you have to give more pressure. Okay. So, compliance is opposite to surface tension. In the same way, compliance is opposite to elasticity. What is elasticity? Recoiling nature, collapsing back. So, compliance and elasticity are opposite to each other. Having said that, see, if you want to make a relationship between compliance and elastance, we have just discussed compliance and elastance, they are opposite to each other. So, compliance is inversely proportional to elastance. Now, let us see some conditions where the compliance is going to be increased and compliance is going to be decreased. First condition which I want to discuss here is emphysema. Now, in emphysema, what exactly happens? Simple. Remember guys, in emphysema, there is destruction of destruction of elastin fibers. Elastin fibers in lungs. In emphysema, elastin fibers in the lungs are gone, damaged. Whenever the elastin fibers are not there, elastic recoiling property of the lungs is decreased. Elastic recoil is decreased. Now, when the elastic recoil is not there means the compliance will be more. Why? Because elasticity and compliance are opposite to each other. If you decrease the elasticity, automatically compliance nature is going to be increased. Okay. So, in emphysema, what happened to compliance? Compliance increases because loss of elasticity or elastic recoil. Why? Because elastin fibers are damaged. Now, let's talk about the pulmonary fibrosis. In pulmonary fibrosis, very simple. The alveoli are getting fibrotic. The alveolar basement membrane is getting fibrotic, totally replaced with the fibers. Now, are you easily able to expand such a fibrotic structure? No. Entirely the alveolus is replaced with the fibers. So, such a fibers cannot be expanded. Such an alveolus, fibrotic alveolus, you cannot expand it. Such a alveolus with a scar, you cannot expand it. So, what happened to the compliance? Compliance decreases. Compliance decreases in pulmonary fibrosis. Now, having said that, let's see what are the different types of compliance. Okay, types of compliance. There are three types of compliance. First one is static compliance, dynamic compliance and specific compliance. Okay. Now, what exactly is static compliance? See, static compliance is measured during no airflow. See, the person is going to take the breath and he is holding like this, breath holding. Okay, the person is now doing breath holding. Now you are measuring the compliance of the lungs during breath holding. So, this compliance is called as a static compliance. One point I want you to know here is the compliance of the lung is not going to be same. It's not same during inspiration and expiration. The compliance of the lung changes with the different phases of inspiration and expiration. Sometimes lungs are more compliant and sometimes the lungs will become less compliant. Okay, we will discuss that in pressure volume loops, but for right now, remember this one point, lung compliance changes with the different conditions. Okay, with the different phases of breathing. Now, what is static compliance? In the name static, no airflow is there. Whenever there is no airflow, if you are measuring the lung compliance, then it is called as a static compliance, measured during no airflow during breath holding. The patient is holding his breath. Now you are measuring the compliance of the lung. Okay, how much compliant the lungs are. That is static compliance. Now, what is dynamic compliance? Dynamic compliance is measuring the lung compliance during inspiration or expiration. I have said you that during inspiration and expiration lung compliance changes. Most of the students will think lungs are more compliant during inspiration, sir. No, that's very wrong statement. Lungs are more compliant during expiration. Okay, so at the end of the day we will discuss about that. But right now see, the lung compliance changes during inspiration and expiration. So if you measure the compliance of lung during airflow, okay, during inspiration and expiration, then it is called as a dynamic. Dynamic means changes. Okay, changing in the compliance during inspiration as well as expiration. That's a dynamic compliance. Now, what is specific compliance? Specific compliance, the formula is compliance of the lung for particular functional residual capacity at a particular functional residual capacity. If you measure the compliance, it is called as specific compliance. So, specific compliance is the compliance of lung at particular functional residual capacity. Compliance divided by functional residual capacity will give you specific compliance. Now, having said that, let's start with the elasticity. Let's start to discuss about the elasticity. Already we have discussed elasticity means recoiling nature, getting back to its original position or resisting the deformation in its shape. That's the elasticity. Now, let's see the definition: ability to resist the deformation. If you deform its shape, it will again go back to its original position. That is elasticity. Okay, going back to original shape or elastic recoil. Now, what causes the elasticity in the lung or what causes recoiling of the lung? There are two collapsing forces inside the lung. First collapsing force is the surface tension. Surface tension is responsible for the elasticity of the lung. See, the surface tension, whatever is there inside the lung, it will try to collapse the lung. One thing, and the elasticity, because of the elastin fibers and collagen fibers. Elastin fibers and collagen fibers are also responsible for the recoiling nature of the lung. So lung is collapsing because of two reasons. One is surface tension and the other reason is presence of elastin fibers and collagen fibers. Okay. Now, what happens? See, here is a question. What happens to the compliance? Okay, this is compliance. This is a spelling mistake. Please correct it. What happens to the compliance? COMPLIANCE. Okay, compliance of a saline filled lung. Of a saline filled lung. What do see now? Here is the alveolus. Okay, now what you are doing? You are filling the entire lung with the saline. Now just think logically and tell me what happened to the compliance. Normally, compliance, or I should say, surface tension is going to be due to what? In a normal lung, there is air here and there is water. There is air-water interference. Air-water interference is there. Now, whenever air-water interference is there, they develop a force called a surface tension, and surface tension is a recoiling force, collapsing force. Now, if I fill the entire alveolus with saline, okay, if I fill the entire alveolus with saline, there is no air-water interference, there is no air. Whenever there is no water interference, there is no surface tension. Surface tension is not going to be there. Whenever there is no surface tension or whenever there is no collapsing force, okay, now surface tension is not there. Whenever there is no surface tension, what happened to compliance? In the previous slide we have discussed, what is that? Compliance is opposite to surface tension. When surface tension decreases, what happened to compliance? Compliance increases. So in a saline filled lung, there is more compliance because surface tension is not there. Okay, if you fill the lung with saline, you have removed what? You have removed air fluid interference or air water interference is removed. Now it's just water interference. Okay, air is not there, just water and water is there. Okay, so therefore there is no surface tension, less recoil is there. Okay, less collapsing force is there. So lungs are now more compliant. More compliance is there in the lungs. Now such a saline filled lung will have only elasticity, not the surface tension. Surface tension is not there. So saline filled lung will undergo recoiling only because of the elasticity due to elastin fibers, not the surface tension. So saline filled lungs recoils only due to elasticity because of elastin fibers. So with this, we have discussed the concept of compliance and elastance. In the next video, we will discuss about the pressure volume loops. Okay, pressure volume loops. So what exactly is pressure volume loop? Pressure, change in the pressure with the change in volume. So in pressure volume loops, what we are exactly calculating? We are calculating the compliance of the lung. We are looking at the compliance of the lung during inspiration and during expiration. I have explained to you already that the compliance of lung is more during when? During expiration, not during inspiration. That we will discuss in the upcoming video. Hope the video is helpful. Thank you.